For years, chemotherapy has typically been the first line of treatment for cancer patients, but research is changing that. Here to explain is Dr. David Spiegel of the Sarah Cannon Research Institute. So David, let's start out with how many people are diagnosed with lung cancer?
Yeah, unfortunately, it's a lot of men and women who are diagnosed every year in America with lung cancer. It's over 220,000 men and women who will be diagnosed with this, and what's also somewhat not as well known is that this cancer is often diagnosed at a more advanced stage. So when a patient finds out they have lung cancer, it's already at a place where it may not be curable, and treatment could be a little bit more long-lasting for them.
Wow. Now, what are biomarkers, and how can you test for them?
So biomarkers are simply, well, it's a term we use to describe switches in cancer. One simple way of thinking about this is thinking of it as a light switch. And there are probably many different kinds of switches that can be turned on or off in cancers. So biomarker testing is really trying to look deeper into the cancer, not just saying it's lung cancer for you, Mr. Smith, but it's a lung cancer that has this switch turned on, and we may have a therapy that can turn that switch off. So it's an advancing understanding of what drives cancer, what causes it to behave the way it does.
So what treatments are now available based on this type of biomarker testing?
Well, we've always had chemotherapy, but the biomarker testing has led to a whole new wave of therapies. Many of these are oral therapies that can target these specific switches and turn them off. Some of these are already approved standard treatments in lung cancer. Some hopefully are not that far around the corner in terms of being approved. The whole field is moving quite fast, but it's important to understand the testing is here now, the therapies are here now, and more is coming literally every few months, every year.
Okay. Well, who should go through biomarker testing then?
Right now we have guidelines that try to steer us in certain directions within lung cancer. So there are different types of lung cancer where biomarker testing seems to be the best, the most appropriate way to think about upfront testing. But we're not far from thinking about testing everybody with lung cancer. That's not here now, and it's a conversation that patients need to have with their doctor to understand, okay, the lung cancer I have, should we do testing for it? Is that considered something that's appropriate now? So I really think it's hard to give a one-size-fits-all answer. It's important to say that testing should be discussed with your doctor, and it's very likely you should and need to have that done.
Can be pretty scary. Now, those who are diagnosed with lung cancer, what questions should you ask your doctor?
Well, it's complicated. There's a lot of things to discuss when you find out you have lung cancer. You want to know about the diagnosis. What are my treatment options? What are the side effects? How can I expect to do? But the other important part here is testing. So what is testing? Can my doctor explain it? Explain whether I should have it? How can we get it done? Maybe it's already been done, because that's happening a lot now too, and my doctor just hasn't even brought it up with me. If it's been done, what are the results, and how are we going to use that information to help me?
Good information to know. And where can we go for more information on all of this?
There's a lot of resources out there. Certainly a doctor, their office, the community resources, I think, are invaluable in helping patients and families understand the diagnosis, a bit about testing. There also are places available, for example, on the internet for providers, for doctors, nurses to go to learn more about this as well. It's a fast-moving field. One of these websites is letstestnow.com. It's a good resource for learning about biomarkers within lung cancer and what I can do with that information, how it's going to help me care for my patients.
All right, David, great. Thank you so much. We're going to have all of this information on our website. Check out fox4morningblend.com. Aging is a natural process, but it doesn't mean that you can't bring back youthfulness. How Botox can be your simple fix to erasing those fine lines. Stay with us.